Oral hygiene is practice of keeping your mouth, and by mouth I mean to say not only teeth but your tongue and your gums. We have to keep them free from infection and plaque. So we need to do regular brushing and flossing and mouth rinses, which are very important, which I think we are ignoring these days. And we need to clean our tongue also after your brushing. Oral hygiene is very vital to an individual's overall health and well-being. So we know studies have shown that there are untreated oral diseases which have increased risk of adverse health conditions. So oral diseases are not limited to your oral health. It can affect your general health as well. So maintaining a good oral hygiene is very important in improving your oral health and overall well-being. So it is not only oral health, it's overall well-being which you need to consider when you're maintaining your oral health. Mouth is always known as doorway to your entire body. So it serves as a vantage point for detecting early symptoms of many systemic diseases, which are general body diseases. So it is very important to maintain oral hygiene and go for regular oral checkups to your dentist. Like every 6 months or every 3 months, you should visit your dentist and you should go for regular oral health checkups, because there are many conditions like pneumonia, then infective endocarditis, then there are pregnancy complications, then there are some cancers which we can actually diagnose from oral examination. So oral examination is not only for your oral health, it is for your general well-being. Lots of patients have this mindset in that brushing once is enough. No, we need to brush twice. We need to brush morning and night. Why in the morning? See, when we sleep, our salivary secretion becomes very slow. So which makes the mouth dry. So amount of bacteria is more at the night compared to morning. So when we are sleeping, there can be chances that our bacteria accumulation is more. So we have to brush in the morning. And now you want to ask me why we need to brush at night. So now morning we are brushing because saliva is low. But night we have to brush because we are eating whole day. There is plaque accumulation, that is for sure. Every 6 hours you accumulate plaque on your teeth and that needs to be removed. So night brushing is also very important. We cannot skip it. Not only brushing, you need to do flossing with brushing. That is once a day is also enough. Usually we have a mindset that whenever our bristles are getting distorted or whenever our bristles are not in shape, we need to change our brush. No, this is a misconception. Manual brush, if you're using, you need to change it every 2 or maximum 3 months. Whenever your bristles already look worn, they're worn out or earlier. So you need to change it every 2 months. I would suggest every 2 months you need to change your manual brush. But if you're using your oscillating toothbrush, or electronic toothbrush, then you can carry for 3 months or 3 to 4 months, but not more than 6 months. Because I have heard from my patients that they are changing once in a year their electronic brush. So they need to change every 3 to 4 months. We all know that poor oral hygiene can have very serious consequences for the mouth as well as your overall body. So, including gum diseases, rotten breath, yellow teeth, cavities, and even dying teeth. Like we can lose our teeth if we don't maintain our oral hygiene. Like I've seen patients who have never brushed. They come from very remote areas, so they've never brushed in their lives. So at the age of 14 or 15 only, they get their teeth loose, like they have loose teeth. So we are left with no other choice than extractions. So I would say that there can be many problems, and few most common diseases which can actually occur from an unhealthy mouth are diabetes, cardiovascular conditions, then there are some respiratory conditions, Then I would like to suggest on one point, that is during pregnancy. During pregnancy, we need to take extra care of our oral hygiene because uh, due to some hormonal changes, we tend to develop gum diseases. There can be swollen gums during pregnancy. So there should be extra cautious, and you should maintain your oral hygiene in pregnancy, I would say, more as compared to your regular days. And you should visit your dentist like twice or thrice during your full pregnancy. You should visit at least in every trimester, you should see a dentist. Flossing is nothing. See, if you know, we have a normal thread at home. So floss is nothing but it's a thread which is actually designed for cleaning areas which cannot be cleaned normally by our toothbrushes. So flossing is between the two teeth, or whenever you have a cap, you need to use floss because there is a gap between two teeth. When we give a cap, there can be a gap between two teeth where your food can accumulate. So our normal brush cannot reach those areas. That is a very, you can say, very thin area. So normal brush cannot reach those areas. So we need to use flossing, and we need to do it every night, especially for our molars. For once, you can skip your anteriors, you can skip your front teeth, but for your back teeth, they are absolute yes, every day, every night. I highly recommend that you should get your dental examination done at least twice a year, and your cleaning, that is oral prophylaxis, or you call it as scaling also, that also should be done at least twice a year. So twice a year, I would suggest you should visit your dentist. And if people say that dental treatment is expensive, then I would say no, your dental neglect is expensive, not your dental treatment. If you keep visiting your dentist, if you keep visiting them regularly, you will not find it expensive.